Now, protests erupt in China's Xinjiang region, its capital, Beijing and Shanghai, as public anger grows over prolonged COVID-19 lockdowns in the country. China has seen a hike in the number of cases recently. However, local residents are calling for an end to COVID restrictions in the country. The recent fire that killed about 10 people in a building fueled their anger further. Here's a report.
Lift COVID lockdown is what this crowd in China's far western Xinjiang region is chanting after a deadly fire in a high-rise building triggered rare protests over the country's prolonged COVID lockdown. Videos circulating on Chinese social media show residents in the region's capital, Urumqi, arguing with guards in hazmat suits. And it comes as China's government grapples with widespread confusion and uncertainty in its big cities over the virus. China defends President Xi Jinping's signature zero-COVID policy as life-saving and necessary. The country recently tweaked its measures, shortening quarantines and taking other targeted steps, but cases have been rising. Xinjiang is under some of the country's longest lockdowns. Many of Urumqi's 4 million residents are barred from leaving their homes for as long as 100 days. The protests followed the fire, which killed 10 people on Thursday night. Authorities have said the building's residents had been able to go downstairs, but videos shared on social media led many to believe that residents could not escape in time, because the building was partially locked down. Urumqi officials denied that COVID measures had hampered escape and rescue, but said they would investigate further.
Now, for more on this, we are being joined by Andrew K. Leung, an international and independent China analyst. Now, thank you for being with us. Despite China's zero-COVID policy, they have reached a new record number of cases. What are the latest details that you have for us?
First of all, one has got to understand what zero-COVID policy actually means in China. It doesn't mean that all cases must be stopped, must be reduced to zero. At all times, in all circumstances. This is not really the case. The strategy really is to try to keep the cases to the bare possible minimum, preferably, of course, zero. But then the most important is it consists of several strands. First of all, early detection, early isolation, and early prevention. So that's, in fact, China has been relatively successful considering China's very large population, 1/5 of mankind, 1.4 billion people. Now, as far as the number of deaths are concerned, because of the new variant of the virus, I think the latest registered number is something like 30,000 or thereabouts. But compare with a country which is 11 times less population, I'm referring to Japan. Japan registered 60,000 compared with China's 30,000, but Japan's population is 11 or 12 times smaller. So you can see that comparatively speaking, China has been doing relatively well. And the important thing to remember is that China's medical facilities and medical coverage are not by far inferior to those in Japan. And also, the most vulnerable group in China are those over 60 years old, and then their vaccination rate is extremely low, something like below 40%, not even with one jab. So the legitimacy of the Communist Party, which puts people's welfare and safety first, dictates that China cannot let down this vigilance. Secondly, learning from other experience in other people in other countries, but also in Hong Kong and also by itself, is trying to refine this strategy. You can see that the latest kind of guidelines handed down to the provinces is that the people must not cast everything in stone. And then each and every city, each and every village or town has got to adapt to local circumstances. Sometimes you need to be very, very strict, and sometimes depending on the density of the people, depending on the type of operations, and then each and every location can adapt to the various circumstances. Now, of course, there are unrest and so on being reported. After 3.5 years, it's understandable people are frustrated. But then, on the whole, the whole of Chinese people seem to be very supportive of the Chinese government's policy, as evidenced in the latest public opinion survey conducted by the Edelman, ELEDMAN, based in the United States, surveying the public attitude towards the trust in the government. In the latest report in January this year, 2022, China scored top of the ranks because of its relatively successful strategy to contain the virus, compared with, for example, the United States. The United States has registered over 1 million deaths. And then if China's population is 4 times as many, then China would have registered 4 million deaths. And now China's death toll is far, far, far smaller than that. Let alone that the large concentration of the people in coastal cities and the lack of relatively advanced medical facilities, and then the vulnerable group, the elderly over 60, with a very, very low infection rate. So you've got to understand all these various dynamics and not treat China as if it's just another country.
Right. Andrew, we'll leave it there. Thank you very much for joining us with the latest details on COVID in China.
WION, now available in your country. Download the app now. Get all the news on the move.